Bismillah ar-Rahman ar-Rahim. In this lecture, I will talk about thyroid nodules. Thyroid nodules are very common, especially in the USA. In fact, experts estimate that about half of Americans will have one by time they're 60 years old. Some are solid, and some are a fluid-filled cyst. Others are mixed. The vast majority, more than 95% of thyroid nodules are benign or non-cancerous. Healthcare providers detect them in approximately 5 to 7% of adults during a physical exam. They are 3 times more common in women than in men. The incidence of thyroid nodules increases with age. At age 30, 30% of women will have a thyroid nodule compared to 1 in 40 men, 2.5% the same age. %50 of 50-year-old women will have at least one thyroid nodule. 60% of 60-year-old women will have at least one thyroid nodule. 70% of 70-year-old women will have at least one thyroid nodule. Ultrasound imaging reveals that 20 to 76% of adults have thyroid nodules. Thyroid nodules are less common in children. Now, symptoms and signs of thyroid nodules. Most thyroid nodules don't cause signs and symptoms, but occasionally some nodules become so large that they can be felt, be seen, often as a swelling at the base of the neck, press on the windpipe or esophagus, causing shortness of breath or difficulty swallowing. In some cases, thyroid nodules gives extra thyroxine hormone. This case called hyperthyroidism. The symptoms and signs in this case are bulging eyes, enlarged thyroid gland, abnormal heart rate, increased appetite, irregular menstruation, irritability, nervousness, heat intolerance, sleeplessness, vision problem, hand tremors, vomiting, diarrhea, enlarged liver, frequent sweating, hair loss. In this slide, we are seeing here case of toxic thyroid nodules. Sometimes a thyroid nodule present as fluid-filled cavity called a thyroid cyst. only a small number of thyroid nodules are cancerous, but determining which nodules are cancerous can't be done by evaluating the symptoms alone. We are seeing here case of papillary cancer, here thyroid cancer. Most cancerous thyroid nodules are slow growing, may be small when the doctor discovers them. Aggressive thyroid cancer are rare with nodules that may be large, firm, fixed, and rapid growing. In this slide, we are seeing here papillary cancer. Here, small size of thyroid cancer. Here, we are seeing anaplastic thyroid cancer. Thyroid nodules are sometimes found in people who have Hashimoto's disease. Symptoms and signs in this case: constipation, dry skin or thick skin, fatigue, hair loss, feeling cold, weight gain, irregular menstrual period, depression, swelling of the thyroid gland. Now, causes of thyroid nodules. The first cause of thyroid nodules is overgrowth of normal thyroid tissue. It is sometimes referred to as a thyroid adenoma. It is unclear why this occurs. Some thyroid adenomas lead to hyperthyroidism or excessive production of thyroid hormones. The second cause of thyroid nodules is thyroid cyst. Fluid-filled cavities or cyst in the most commonly result from degenerating thyroid adenomas. The third cause of thyroid nodules is chronic inflammation of the thyroid gland. For example, Hashimoto's disease or Hashimoto's thyroiditis. This often associated with hypothyroidism. The fourth cause of thyroid nodules is multinodular goiter. It contains multiple distinct nodules within the goiter, but its cause is less clear. We are seeing here multinodular goiter. Here we are seeing hemorrhage within a nodule. Here, nodules, asymmetric enlargement of the thyroid gland by multiple nodules of different sizes. We are seeing here multinodular goiter, here unilateral sweating. The fifth cause of thyroid nodules is thyroid cancer. The chance that nodule is cancerous are small. However, a nodule that is large and hard or causes pain or discomfort is more worrisome. We are seeing here case of papillary cancer. Here we are seeing anaplastic thyroid cancer. The sixth cause of thyroid nodules is iodine deficiency. Lack of iodine in diet can sometimes cause the thyroid gland to develop thyroid nodules. Now, complications of thyroid nodules: problems swallowing or breathing, large nodules or multinodular goiter can interfere with swallowing or breathing. Hyperthyroidism. Problems can occur when a nodule or goiter produce thyroid hormone, leading to excess amount of the hormone in the body. Symptoms and signs of hyperthyroidism: bulging eyes, enlarged thyroid gland, abnormal heart rate, increased appetite, irregular menstruation, hand tremors, irritability, nervousness, heat intolerance, sleeplessness, vision problem, vomiting, diarrhea, enlarged liver, frequent sweating, hair loss. We are seeing here case of hyperthyroidism. Problems related to thyroid nodule surgery. If your doctor recommends surgery to remove a nodule, you may need to take thyroid hormone replacement therapy for the rest of your life. Now, diagnosis of thyroid nodules. We will begin with physical examination, and we will make blood tests, reveal levels of FT3, FT4 TSH, ultrasound of the thyroid gland, CT scan of the thyroid gland, fine needle aspiration cytology of the thyroid gland. Treatment of the thyroid nodules. Treatment depends on the type of the thyroid nodule. Treating benign nodules. If a doctor has declared a nodule benign from tests, they will monitor the person closely with physical exam and ultrasound every 6 to 12 months. If large nodules are causing swallowing or breathing difficulties or affecting thyroid hormones, people may require surgery to remove the nodule. Now, treatment cancerous nodules. If doctor suspect a thyroid nodule is cancerous, people may have surgery and radioactive iodine therapy to remove the thyroid gland and destroy any harmful cells. Indications: surgery in the thyroid nodules. Too large thyroid gland, hyperfunction or hyperthyroidism, causing difficulties with breathing or swallowing. Cancerous, we are seeing here case of papillary cancer, difficult to distinguish as benign. We are seeing here ultrasound showing thyroid nodule with suspicious sonographic features or microcalcifications. In the end of this lecture, thank you for all.